are not here to sell medicines, but provide solutions. And therefore, we are a platform for solutions, whether in capacity building, whether in the research and development, whether it's in facilitating technologies and medicines to be in the hands of the patients who need them. In the COVID era, which is in the last 2 years, the biggest breakthrough that we have seen is what I term home-based care. If we can Uber in and utilizing a digital platform for technology, then I think those are great innovations that we have seen. As a patient, instead of taking an Uber to go to Kenyatta or to go to a facility, whatever it is, I would Uber a nurse to come and give me my injection at home. Your blood pressure can be provided by great services by our community health workers, especially in our public sector. Your phone actually is your next platform for your pharmacy services. I think the other innovation that we have seen in the last 2 years has been platforms that are coming in as distribution platforms that are online. You can order and have full visibility of prices and medicines. And for me, that is actually where we have been long before even today. But that disruption and speaking to supply chain is there to stay. There is need for concerted efforts by the African governments to align and agree where do we set up the centers of excellence. So as we fight for local production, we need to think about also empowering the consumers. That's why for me the supply chain conversation starts and ends with the patient in mind. Unless we empower the consumer, the tail end of the supply chain conversation, even with local manufacturing, it will be typically writing on water.